The thing I love most about boxing is it's a constant challenge. It challenges you physically, mentally, emotionally, and psychologically. It forces you to confront all the weaknesses inside of you and do something about them in an environment where there is a very high and intense negative feedback mechanism for getting it wrong. I got into boxing because I wasn't doing anything else with my life, and I felt like I needed to put some sweat equity in somewhere. And so I found a boxing gym. It looked like something I could do and stuck with it, and the rest is history. With good decision making and a strong work ethic, I had a really outstanding amateur career and went on to have a pretty good professional career too. In 2011, I won the PA Golden Gloves. Then I went and won the National Police Athletic League tournament. I got a number 4 ranking in the amateur spot. That was the peak ranking I reached for USA Boxing's amateur rankings in the United States. And I got a pretty nice sponsorship deal training in Los Angeles, California. Getting knocked out, it took me like 7 or 8 months to watch the fight again because I still felt this certain level of embarrassment because your ego gets crushed. But once I watched it again, I was like, oh, this isn't a big deal. No one is undefeated in life. I think boxing is the best analogy for life because you have to continue to pursue your goal no matter how much pain you're in or how hard you get hit. And that's the biggest parallel for me, is that I have to keep going and keep doing things. I took a year off after 2016 when I lost the fight. I took a year off, let my body heal, focused on finishing school. And then I actually was back in the gym in 2018. And then I was training and got injured. And my coach was just like, I'll keep training you, but you don't really have to do this anymore, looking at the position my life was in. And I said, let me think about it. And I just took some time off and went and did the things that I wanted to do. I did traveling, I hung out with the wife a lot. Life was really, it was a good time. And so for me, it wasn't retirement because I couldn't do it anymore. It just made sense at the time of my life to step away and go do other things.
I first met Ed Latimore on Twitter, and there was an event in his hometown that I wanted to go to. So I said, hey man, I'm coming into town, let's get together. And he said, yeah. And from there, we just stayed in touch. His boxing career at the time was winding down. And, after I had started Rebel Health, I reached out to him and I was like, hey man, you should come do this program with us. The inspiration for Rebel Health was a personal one. A few years ago, I thought I was doing everything right. I was lifting weights, I was doing a little bit of cardio, I've been an athlete, and I thought I was in good health, but I was feeling bad all the time. I woke up feeling terrible every morning. I learned that I was sick, and I had no idea. I was pre-diabetic. I had elevated cholesterol. I had inflammation scores off the chart, which leads to all kinds of metabolic disorders. And it was no wonder that I was feeling terrible because I was sick. And so together with people in my network, I knew some doctors, I knew strength coaches, I knew dietitians, nutritionists, and I started to cobble together a plan for myself. I did what they told me to do, and 6 months later, I had reduced my body fat to 12%. I had lowered my A1C back into normal ranges. I had reduced all the inflammation in my body. And I was feeling amazing. And it was then I realized that there had to be other similar people in my same position who would be happy with a product like this.
My medical team before I started working with Rebel Health was probably the typical experience that an American has with the medical establishment, which is that there's not even really a team unless something goes terribly wrong. I had a primary care physician like most people, and it actually really bugged him that I got my own blood work. And I said, that's crazy that you would have an attitude like that towards someone being protective and then taking preventative measures for their own health.
The modern healthcare model is absolutely broken in America. When I was thinking about starting Rebel Health, I realized that I was just pointing my fingers all the time saying there's something wrong with healthcare in America. Look at the obesity crisis. Look at the metabolic health crisis. Look at how our collective health is just deteriorating every single day. And I got tired of saying, hey, somebody should do something about that. So I decided, hey, let's get this going and let's see what we can do. And so we brought him on board and he got started with our optimization and metabolic health program without any notion at that time of coming back to his professional boxing career. And it was through the process with Rebel Health that he was able to identify some things that had been holding him back that he was able to fix.
Here were some interesting findings from the blood work. I have a chronically elevated level of reverse T3. So all of this signals effectively a certain type of hypothyroidism. I also learned that I need to get more omega-3s in my diet, more omega-3 fats. And most notably, I have an incredibly high susceptibility to alcoholism, not just because of my neurochemistry, but also my body's great at metabolizing alcohol. So it'll take more for me to get drunk. And knowing that really put a lot of my history into context. So it's one of those pieces of information that if you had it and you knew, maybe you wouldn't take a drink or try a drug, just seeing where your susceptibility lies for things.
Your phenotype is what you're expressing.
Okay.
So, and there can be differences because of the influence of our environment.
At Rebel Health, you no longer have to be the quarterback of your own team. You don't have to go to one doctor over here and maybe have a trainer over here or maybe have a dietitian over here and then be the one translating all this information back and forth and experiencing data loss and confusion and you forgot to talk about it or you didn't know this other thing was important. Our coordinated care team model means that your doctor talks to your strength coach talks to your dietitian, your genetic counselor talks to everybody. They all know what you're doing, so you're getting the right fuel for your workouts, and your workouts are what you need to match with your blood work needs, to match with your overall healthcare plan. You're never going to be sloughed off on somebody that's just a health coach or doesn't have any training in their field or isn't highly credentialed. What makes them amazing is their commitment to your health, their commitment to preventing disease, and their commitment to having you feel amazing every single day, achieving peak health. Coordinated care is what everyone needs to solve the problems and put you on the shortest, straightest line to the health outcomes that you desire.
I was doing some coaching part-time, and I wanted to make sure everything I explained was sound, that it would stand up, because my thinking about all sports is that there's an optimal way to do things. And so right around that time, my coach called me and asked me a question about why you should have your foot a certain way when you hook. Well, he wasn't asking me the question why, he knew why. But as I started diving into this, I was like, oh, there's a whole lot of things that are like incorrectly taught in boxing, and what would happen if somebody actually focused and fixed those things. And then as I went through that and was just working on things myself, I also realized that there was a whole baseline of movement that I didn't have, and I have it now, and I wanted to test it and try it out. And there's only one way to do it: test it and get data back myself and continue to refine it. This is one of the reasons why I decided to box again, because I said to myself, look, if I was able to do all of this with a suboptimal engine, what can I do now that everything is really clicking and moving? I needed to get some tests to fight again, and I could already see the headache that it would be to get my primary care doctor to write a script for a full neurological exam and a stress echocardiogram. And so I just sidestepped them completely and went to Rebel Health and got those scripts written.
Because of the process with Rebel Health, his health and energy improved so much that the thought of returning to professional boxing at 38, 39, 40 started to enter into his head. And so we kept working with him as he was going through his training process once he made the decision. And we've just been with him every step of the way on this way back to coming back to the ring at age 40.
When I was an amateur fighter, I used to get nightmares before a fight, and I realized that the only way to deal with this was just to train harder. And as I progressed in my career, I realized that all that is a sign that I don't feel as prepared as I should be to meet the challenge. But I feel really prepared and at peace, and everything is well.
I did not come to play. I ain't got no limit.
Facing a trained professional whose only goal was to hurt me or knock me out, I can only speak to how I feel about it, but it's never really fazed me. You know, the worst thing that'll happen is I'll die, but that's unlikely. I'll just get hurt and have my ego shattered, and having already lost once, you realize it's not that bad. If I go into a fight, I have prepared myself. And that preparation is the antidote to any type of apprehension or fear that I have or anxiety. It's just, these are all tricks of the trade to keep yourself from being afraid. That doesn't mean you're not afraid, but you have to use it instead of letting it use you.
Yeah, that's right.
Rebel Health has been a powerful ally in my quest to stay in peak optimal health as I get older. I'm fighting again at 40, and I feel just as good, if not better, than I did at 30.
You can expand your health span by making a conscious choice of building your metabolic health, focusing on longevity and optimization, and giving yourself the best chance to live the longest, healthiest life possible. Decline is truly a choice today.
Because of the blood work that Rebel Health evaluates with me and the medications they make available to me if I need them and their expertise, I feel like if I'm getting even close to any type of chronic disease that is preventable, I'm able to take steps to dial those metrics back and get into a healthy, optimal, peak health range. I think Rebel Health is the future of healthcare.